As we look at these different joint, muscle, and bone conditions, ultimately it comes down to this balance between regenerative factors versus restorative factors. When a person starts to have things stacked against them, where their musculoskeletal system starts to deteriorate, whether they start to have osteoarthritis and knee degeneration, where they can't move anymore, move as well or as often, really age 30 and above is where the inflammatory cascade starts to amplify itself. As people get into age 40, 50, and 60 each decade, it gets worse and worse as a general average of the inflammatory responses throughout life. So resolution of the inflammatory response is the key thing. So for the most part, if someone has muscle mass loss, chronic arthritis, or osteoporosis, we as clinicians have to think about what's going on with their inflammatory system. But typically, when most people have muscle inflammation, especially as they get older, they get more inflammaging, that doesn't cause any obvious symptoms. Muscle inflammation doesn't cause a lot of pain. There is a clinical effect that inflammation is going to uncouple muscle mitochondria, which makes ATP energy. It takes days to recover. Chronic inflammation will not only impair muscle mitochondria, but also affects mitochondria throughout the entire body and will activate pain receptors throughout the musculoskeletal system and the body. I have no motivation. I'm mentally tired. I'm depressed. I can't sleep. There's just all those things add up. They're chronically inflamed. One of the things that can really change everything is if they move, but if they have high degrees of inflammation, you can make them worse by putting into an overtraining syndrome. The general inflammation is one of the main contributors to bone loss. It's not calcium deficiency. Systemic arthritic inflammation is a key indicator of significant risk for cardiovascular disease, cancer, and dementia. What really they have is a systemic inflammatory response, which is going to turn on genes with other variables that are then going to express into chronic disease. Key concept: the more body fat an individual has, the more baseline inflammation they will have, right? So studies have clearly shown body fat itself releases inflammatory adipokines that produce inflammation. The worst scenario for promoting systemic inflammation is increased body fat and decreased muscle mass. This is known as skinny fat. This is all the factors you need for severe inflammation: not enough muscle mass, decreased myokine activity, and more body fat. So even just moving around, doing a few squats, contracting some muscles can completely shut down this inflammatory cascade, as long as they just move. Insulin surges. The key clinical indication of insulin surges, like fatigue after meals. People get really tired, feel like crave sugar after meals. Those are indication of insulin surges. And when people have insulin surges, their insulin levels are high. Insulin directly activates macrophages, T cells, fibroblasts, and B cells to promote an inflammatory cascade. Insulin will activate glial cells, turn on inflammatory cascades. So you just get inflammation promoted throughout the entire body. You could have people have their pain reduced in 50%, like in a week sometimes, just by stopping their insulin surges. So the blood glucose and insulin levels look fine, unless they do a glucose tolerance test. Basically, insulin will drive chronic inflammation throughout the body, and this chronic inflammation will then cause ongoing muscle deterioration, inability for someone to develop muscle mass, or more importantly, muscle mass recovery. We really need to look at the microbiome and things like intestinal permeability. And there's like departments at universities, and they're like, we're the gut bladder axis research team. And they study how the gut impacts bladder conditions. And they do phenomenal research. The second part of this, which really activates the cascade, is if people have dysbiosis and then their tight junctions break down. So whatever can disrupt their microbiome doesn't have to just be diet. Various chronic diseases disrupt the microbiome. They get dysbiosis, they get intestinal permeability. They get these bacterial endotoxins like LPS cross into their system. This then binds to those receptors, then they get systemic inflammatory responses. These studies have shown that when people have inflamed guts, that they end up with promotion of the rheumatoid arthritis. Rheumatoid arthritis being an autoimmune disease. And there's clear indications of dysbiosis, intestinal permeability, leaky gut, endotoxemia in the current literature as being a trigger for RA. For those of us that practice functional medicine, they found that the more inflamed gut they have, the more inflammation and progression of deterioration they have with things like spinal arthritis. They've also shown that it also causes facet degeneration, so they get spinal degeneration here at the facet level. So someone could have the meniscus injury and tear playing a sport. They have a really bad gut. 5 years later, that chronic dysbiosis inflammatory response is theoretically going to accelerate their osteoarthritis at a much faster rate. But these findings suggest the presence of causal relationships between the gut microbiome and cartilage health, independent of diet or adipose sauce, are providing potential therapeutics through manipulation of the microbiome. They're basically saying treat the gut to treat damaged cartilage. When microbiota is dysbiotic, unhealthy, you can get muscle, you can have changes in muscle function, muscle deterioration, muscle changes. So the microbiome becomes especially important if you have arthritis, osteoporosis, or sarcopenia. Just as people can develop leaky gut and chronic inflammation, people can have a leaky pulmonary barrier develop systemic inflammation, which can also impact bone density, muscle mass function, and arthritis. Allergens translocate into systemic circulation, cause an inflammatory response in the whole body, and there's hyperinflammation. So when people start to have things like asthma and COPD and emphysema, they're actually having a hyperinflammatory response throughout their whole body. Everyone is now so against seed oils because they can really cause an inflammatory cascade. They think now flaxseed oil is bad for you. Nut and seed oils are bad for you. Essential fatty acid oils are bad for you. Or essential fatty acid organ meats or black currant seed oil are bad. You can have the arthritis and joint pain completely go away if that was your main deficiency. Some people need to eat red meat to control the inflammation. It isn't about a good or bad guy. You could have someone who tells you when they go on a vacation, their joint inflammation goes away. Then as you dig deeper, you find out when they work, they're stuck in traffic 2 hours each way, and they're just being exposed to car exhaust all day, which is benzene. But over time, we can only make so many antioxidants per day. They get depleted. We also have our liver that takes these compounds into our microbiome that has these phase 1, phase 2 biotransformation enzymes that can change something that's fat soluble and toxic to water soluble so we can get rid of them. That's one of the key symptoms, and it immediately goes away once you get the right dose. Like you get a person stuck in the car having joint pain, you go, hey, why don't you take 6 capsules of this compound glutathione, whatever it is, you like to use N-acetylcysteine or something, see how you feel. Like, oh my God, like way better. Some people accelerate really fast with their degenerative process and aging, and some people don't. How old is this 80-year-old person? They're 45. You're like, oh, so that's accelerated aging. Some people have reactivation of things like Epstein-Barr virus or cytomegalovirus. Some people have persistent parasitic infections. Another very common one is chronic H. pylori infection. And the worst scenario is people that start to lose immunological tolerance. They start reacting to foods, reacting to the environment. They start reacting to their own body, developing autoimmune disease. Because systemic inflammation is going to cause bone loss. So if you're dealing with a patient with risk for osteoporosis, you may want to do the best you can to dampen these effects. Adequate protein intake. You can't recover from any chronic disease without proper protein intake. It's going to cause accelerated aging and deterioration of all their tissues to some degree. Biggest concern is they start to develop sarcopenia. You cannot build muscle without protein. You need to have that building structure. The ratios you need to survive are 0.36 to 1 gram of protein per day. But the doses you really need to maintain muscle mass and grow muscle mass and grow bone mass is 1 gram of protein per pound of body weight. That's the ideal scenario. And if you're below half, that's a problem. Things like growth hormone are also critical for recovery and repair. We'll talk about those more. Myokines and exokines are really critical for joint regeneration, muscle regeneration, bone density development. We've already talked about that a lot, but movement, exercise, contraction is critical. So you have to have more than 6 hours to develop muscle. You have to have protein to develop muscle, and you have to have contraction to develop muscle. And here you can see this nice U shape again with sleep. One of the key indications clinically of sleep apnea is they wake up and they're still tired. Doesn't matter how much sleep they get, they wake up and don't feel rested. They have to take naps throughout the day. Sleep apnea is going to devastate bone health, right? So again, you can take all the calcium you want, you can all the minerals you want, you can take all the hormones you want. If you take a person who's not getting enough sleep, it doesn't matter. Regenerative medicine is a field that aims to restore and replace damaged or diseased tissues and organs by stimulating the body's own repair mechanisms or reusing engineered tissues and cells. People get injected and then they'll start to notice it's starting to heal a week later. Hasn't healed in years. And then 2 weeks later feels a little bit better, and then they usually plateau somewhere between 3 to 8 weeks. It's like magic. Things start to heal. You just haven't had healed for months or years. This was initially done with people that had Achilles tendon tears, but any kind of ligament or tendon injury, it can be very effective. I would say the healthier you are, the less inflamed you are, the greater effect you'd have from platelet-rich pelvic therapy, regenerative medicine therapy. This is unheard of to even happen, just with some stem cell injections over a period of time and 80% improvement in the person's systems. It can be life-changing. If you have someone who's got an injured knee or injured shoulder and they can't move and they can't do activity, it's not just there to reduce inflammation, but cold therapies actually release what are called cold shock proteins, and cold shock proteins actually help with repair. When people have injured joints or injured injuries, have them use cold therapy. You have an injured ankle. There's very few things that have ever been published or shown in the world to help with DNA damage repair. Cold shock proteins is one of them. Hot therapy releases what are called heat shock proteins. Heat shock proteins come in. You can see like HSP7. This is a heat shock protein. It just dampens the inflammatory cascade. Very powerful in reducing inflammation, helping with turning on longevity genes, and really causing recovery. Red light therapy is also very promising when you're looking at repairing injured ligaments, injured muscles, injured tendons. Lots of great research showing how they work. People lie in a mat and have these pulsed EMFs that are released into their system have also been shown to have profound impacts on tissue regeneration and regulation.